Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning. Good morning.
It is a good morning.
I'm gonna touch a few chords of your feelings today.
Yes. Yes, this was interesting when you want to talk about this and called it the dynamics of dying. That's a very good topic.
That's a great topic. And what I want you and the rest of the audience and myself, because, it's going to affect all of us. Personally, it will affect us, and professionally, it will affect us, regardless of what's your profession, what you do in life. And when it comes to dying, you can be as objective, you can be subjective as your profession dictates. But when it affects you personally, we always want to go back and think, okay, who have died in my family? And I don't want you to think like that today. I want you to think forward in the dynamic. Then you can be part of the topic. So some people, by thinking backward, oh yes, I remember my mother when she died, or my father, or my aunt, or my friend when my friend died. I remember that she died with cancer, and what have you. You're sort of hiding your feeling. You don't want to touch on the subject. So I don't want my audience, you or I, to be an observer. Let's be part of the topic.
Well, I can be a very big part of the topic because remember, Bill is 92, and I've been married to him for 41 years, and I never think of his dying because I can't even bear to think of his dying. And he swore he would live to be 100 plus, so I told him I'd kill him if he didn't. But it's right, because that's the name of our book.
That's another book.
Right,
Killing,
that's
dying
our book.
and killing.
Right. So it's a very good topic for me, especially today.
For all of us.
I'm thinking.
For all of us. Because, dying has, you cannot write it in the calendar, okay, unless you're going to commit suicide. But you cannot really write it in the calendar and say, okay, this is my accident day, and this is my hospitalization day, this is my dying day. So I'm going to die at 102. You can be 28 years old, you can be 2 years old, and fall and hurt yourself and die. Look at that little kid that got hit by a baseball bat in the head, and they took him to the hospital. He was a little kid, full of life, and he died. And a friend of mine, that very good attorney, he relocated from Florida to upstate, the East Coast, I think, Massachusetts. And he has two beautiful daughters, just like I do. And one of his daughter, the younger one now is an adult, she's 20-something. But his daughter died, one of his daughters died with cancer as a teenager. And they used to live in my community in Sea Ranch Lakes. And I record that, I always think of my friend, the attorney, of what he went through. And a good friend of mine, he's a psychiatrist, and his wife was driving, and she was hit by a drunk driver, and he lost his only son right here in Boca Raton. And I record, you record that trauma that happened to people, but just, going back, moving forward, we should think about dying. And
what should we think about dying? What should we think?
First of all, die is multidimensional. It's very dynamic. There's a lot of dynamic involved. Some people can put their affairs together because they know that death is imminent. So you have somebody that has end-stage lung disease, end-stage heart disease, end-stage Alzheimer's disease. And end-stage is a tricky word because what is end-stage today didn't even exist 100 years back. And what is end stage today, 100 years from now, people might look back and laugh and say, oh, look, people used to have Alzheimer's. They used to call it end stage because they didn't know what to do. Look at HIV. I remember in the 90s when I started practicing medicine in New York City, people were just let to die. You give them antibiotic. That's the only thing you could do. Nowadays, you can live with HIV basically viral-free, So we look back, and that's only, 10, 15, 20 years. We look back and we say, wow, how much we have advanced in this disease. So end stage, when you hear your loved one has end stage anything, it's a very tricky word because what is end stage to one doctor, to other doctors might say, no, there's still hope.
Well, wait. That brings up a question I want you to ask you about that. Can people make themselves die? I don't mean by poisoning themselves, but let's say, how sometimes somebody's traveling.
They just give up.
Yeah, someone's traveling and they wait till that person arrives and then they die. Someone they love. And I've heard about that. Or then there's somebody that loses a spouse and they're not even sick and then they die.
Then they die very sudden.
How does that all happen?
Well, it's the dynamic of the brain. The dynamic, we know the human body we know so little of the human body. And, I'm talking to you as a physician and as a professor. We know so little what the human body can do. But we know so much less of what the brain can do, the power of the brain. And I tell you that me as a Taekwondo grandmaster, I don't know if I can still do it, but I can tell you I used to, with my bare hand, take a bottle and break the head of the bottle, the top of the bottle without cutting my hand. I could walk on broken glass without cutting my feet. And I could drive a nail through a 2x2 with my bare hand without damaging my skin. And then you touch my hand and it feels as soft as anybody else's hand. So it's what we call mind over matter. So those examples I just gave, they are examples of how when we train the mind, we can overcome so much in matter. And when we think logically, we think of what matter is. You take water, you put it on heat, you boil, and water becomes vapor and disintegrate, and the container would eventually be empty because all the water is gone. And we understand that part, but the energy, the spirit between one phase of the water and the next one, we don't understand that one. So many people, when they know the death is imminent, and they say, okay, my son, my daughter, someone I need to see before I die is going to be here in 2 or 3 days. Then they fight. But we can fight anytime. We can fight before then, and we don't have to die. So it's all how we feel. Are we ready to just let go and die? Or we still want to fight? And the sooner we decide that we want to fight, the more successful we're going to be, like anything in life. And a lot of times I tell it's dynamic. Remember, it's the dynamic of dying. So I have to deal not only with the dying person, but I have to deal as a physician, as a provider, with the family around the dying person. So I usually tell the loved one around the dying person, I say, well, he or she is in a coma. They won't be able to hear me. And I say, that's not true. He said, well, how do you know that? I say, I don't know that, but nobody knows either. So if you ask me, what I would tell you is talk to that person as if they can hear you.
I've always felt that.
You have to talk to, and you have to feel it. It's not, don't fake it. Say, oh, I'm going to talk like if they can hear me, but they really cannot hear me. No, talk to them like they really, really, really can hear you. And you let them know, Uncle John is coming and he's going to be here tomorrow. And if they really can hear you and they feel like fighting, then they're going to fight and they're going to wait for Uncle John because they want Uncle John to see them, you know. And they want their spirit to feel the spirit of the dying one with the spirit of Uncle John, to be able to touch each other and to talk at a different level. That is not the level that you and I know. And I was talking to one of my wonderful, wonderful dentists. I love this guy so much. He is such an artist when it comes to implants.
Dr. Arias?
No.
The other one.
No, Dr. Fari. And, he's from Egypt. And we were talking about his dogs. And he said, Dr. Andy, my dog can really talk. I mean, it's like a human. And he said, I take my dog to the daycare, and he looks at me like, are you coming back?
Of course.
So they are communicating, but he doesn't understand that there is a true communication. It's not the way me and him were conversing yesterday. But it's a different level. And dog can communicate with other dogs, and they can smell things that we can know. We don't understand that we can smell it. We can, because unfortunately we don't use our brain, not even 10% of the potential of the brain. And we don't understand our spirit, not even 1% of the potential of what the spirit can do. And what we can do with the spirit. We don't understand those things. And that's why when I'm teaching Taekwondo and I'm teaching meditation, we say, to a weak person that don't understand their might and their spirit, you can keep them out by putting a lock on the door. But to a strong person, the brick wall means nothing.
I so agree with you. This is a great topic. Normally, if you would say I'm going to talk about dying, it's like, oh, why are we talking about dying? But it's a
beautiful topic.
It is. It's a wonderful topic for people, especially our market is, people who listen to the radio and read Boomer Times. Most of them are over 50, and many of them are 80 and 90.
Mm-hmm.
And so they're listening to this.
Yeah.
And I think a lot of them are
and
probably...
people, something, to our audience that is thinking of the future, you can set yourself up to die. You know that?
That's what I was asking you. How do you set yourself up to die?
Like I live in this small apartment that I hated. I really hate the small apartment. I love a house. And, of course, every money that I get, I invest in my dream, which is my center. And I say, I want to buy a house. I want to buy a beautiful house. And I was having a drink with a friend of mine, and he said, why you want to buy a house? You're going to have a big house, and then, your kids go to college. Then you're going to have to downsize. I say, why do I have to downsize? Then I can get even a bigger house. What are you going to do with a bigger house? I'm not ready to die. I'm living now. This is living. Some people, what they do when they are ready to die, and, you prepare yourself 20 years before you die. You know that?
You do?
Yes. 20 years before you die, around there, you start preparing yourself. So if you have a big house,
is what you're saying. By the way you think,
the way you think and the way you act, the thing
that
you do.
Car,
you don't buy a new car. You say, I'm 80, I'm 90, Bill. Oh, I'm 92. I'm not going to get a new car. Why am I going to buy a ranch or a house? Or no, I'm going to downsize.
Why am I going to get a dog? Right? Because
why am I going to get a dog? I'm dying.
Very interesting.
I'm 92. Well, something I tell my patient when they are 98. I say, you know what? 10 years from now, you and I are going to sit down. Let's talk about this again. And they laugh about it.
I love this.
And I say, don't laugh. I'm serious.
Yep.
You have to think positive. You have to think that, as long as you are going to live your life. Live the here and now. As long as you're going to live.
And if something happens, it happens. But
yes. But, oh, my God, I'm 60 years old. I'm going to buy a big house. Oh, no way. No, I had to downsize. I had to get a small apartment. So when I die, but who say you are dying now? 40 years from now, if you are 60, you're still going to be, chasing. Chasing lovers.
Let me just tell you, we were talking about Bill and the book I showed you he just wrote, and he said when he started this, and he's 90, he said, I'm dedicating my next 10 years to this.
Beautiful.
See, so that's how he thinks. Now I told him you have to dedicate more than just 10 because that's going to happen too fast. So I think
like the Jewish saying, God, may you live to 120. I mean, that's beautiful, track yourself way out there. And if you really believe, the Jewish saying of 120, don't throw the towel at 80. Who said that you are ready to die? Who said that? You get so many people with no medical condition, nothing, and they just drop dead. But they set themselves up. They say, let's go back to this person that just dropped dead. What did they do the past 20 years? Oh, they sold their house. They refused to get a car. They refused to go traveling. They didn't want to go to Europe. They didn't want to do anything. They just want to stay put. And when you do that, you kill yourself. You die.
Well, let's move farther ahead on something about dying, because you and I talked about this, that you and I and Bill, we all are going to give our body to science.
Right.
And I think that's something that's old-fashioned for me to think that people put their body in a casket and they bury it down in the ground. Or they cremate it. I mean, that is like, I don't understand. I mean, that was a tradition. That's why. That's a tradition. But when you can really give something, in fact, I was just talking with Science Care, and they said, now, when a doctor does things and operates on you, whether it's heart, brain, they had to learn from something. And it had to be that kind of research that they had to learn.
And not only that, people that have eye condition, they can take, the part of your eye and use it on young kids that cannot see. Your middle ear, they can use it for people that cannot hear. They can take your heart and give it to somebody that, that cannot have a life because their heart is no good. And so on. It's every bit of your body has some use. The only thing that will not is just your spirit. That is yours. Even that goes to another dimension, to another level in life.
That's lovely. Your spirit. You leave that maybe with your loved ones.
You do. Yeah.
It's basically always there.
Yeah. And people need to understand that that it is the spirit that you really share with others. That's what live. That's what we call it legacy sometimes, And legacy, when we hear and read about the legacy of people that have died, that have nothing, that have never touched your life, it's not the same that when you see the legacy. Let's say Bill died tomorrow, and you have a legacy.
I do.
That is part of your spirit.
Yes.
And it's not the same legacy that I have, because me and him, our two spirits, have crossed paths already. But then you have somebody that hear on the show about Bill, but they never met him. And the spirit can be connected, but not to the same dimension that you and him, and not as little as me and him, but somehow there's some connection in there. So the spirit can reach other dimensions, and
I'm very big on spirit. I think that, and I'm just going to say this, that I have a great spirit with you. I have a great spirit with you.
Yes.
I am so into your body, in a sense.
Yeah.
I know you so well, and I love you, and you are so special, and there's been a bonding that
there had been a beautiful bonding.
Yeah, it is a spirit.
And people ask me, how you guys do this? How you guys came together?
Yeah, it's a spirit. Well, it happened with Mother Ratasha. See, Mother Ratasha and I met, and we bonded so amazingly, and I never talked religion with her. We talked about other kinds of wonderful things, and I felt pain when she died, but not... It wasn't the same as, I knew that she's still there because I still have her.
You still have that spirit connected.
Right?
Yes.
Before we go too much further, because people have to know who you are, I just always love talking with you. But, of course, Dr. Andy Mencia is everything we talk about. He's a doctor, but he's a big spirit, too. And he founded something called AGI Medical and Dental Centers. And they are very exciting. This is his dream, and he has accomplished this over the past 20 years or maybe longer. But he goes after the 7:30 show is over. He goes right down to Fort Lauderdale, where he has an all-day medical practice, and you can go there. It's open on Saturdays. That was unheard of when he first started. Works 6 days a week. Probably works 7 too, but at least the office is open on Saturdays. The location is 1608 East Commercial Boulevard in Fort Lauderdale, and the phone number to call is 954-489-1345. That's 954-489-1345. Something that's happened now, there's so many people that want to see him in the Boynton Beach office that he will be working there by appointment, but you can go to their gorgeous center in Boynton Beach. It's on Hagen Ranch Road. It's 2 miles south of Boynton Beach Boulevard. It's in the public shopping center. I'm going to give you that phone number. I don't want to confuse you, but remember, this is Pencil Talk Radio. So it's 561-270-6494. And the biggest and most important thing is that they have home visit services available for homebound patients. So if you just can't get anywhere, don't fret. You call them, and someone will come there and take care of you, whether it's dental or whether it's physical.
Absolutely.
Okay, Mr. Spirit.
And spiritual. Right. And spirit. And the topic, all my topic inspired by something. I write a quote. Every day I write a quote for my staff and for myself, of course, because it's inspirational quote. It's nothing that I take from books or the internet or nothing. It's inspirational. When I do my meditation, my quotes come out. And my topic, when I come to the show, I want to make my topic really realistic and useful and educational. And yesterday, I saw one of my dying patients. And listening to the grandkids, I don't think she can, she doesn't know who we are. And but they are not touching her, the grandkids are not touching her. She cannot see who we are, and she's all confused now. So I went by the bedside, and I kissed her on the lips. And she opened her beautiful eyes and looked at me. She opened her eyes. I just gave her a big kiss on her lips without her dentures on. And she opened her eyes, and our two spirits connected.
Wow. Wow, course, that's so beautiful.
Yeah. And I say, people need to understand what is really dying all about. It's beautiful. Yeah. Dying is part of living. It's part of life.
That was.
I have a little tears.
I know, but I have to say that's so beautiful, and that's who you are. But that's who you are. And that made her know that it was okay. You could have told her it was okay, but you're doing that. She knew it was okay, and that you cared, and there was something in her.
Yeah,
that was really beautiful.
I tell you, Juan and Oscar can tell you. There's a lady that come with her son. And she has this caregiver. I think the caregiver is from Jamaica or something. She had this caregiver that come with her. And the caregiver been with her like for 6 years. Same time I've been treating her. And she comes in a wheelchair. And she has one of those equipment to lift you up because she cannot stand really. They have to, and they have a special van. The son just take care of her like there's no tomorrow. And she was told maybe 5 or 6 years ago when she became my patient that she has end-stage dementia. And basically just to put her in hospital to let her die. And the son said, I refuse, Dr. Mencia. That's why I'm coming to you. And I say, well, I am training hospice. And he goes, oh. So he got scared, but I'm going to push for hospice. So what I would recommend is we don't have to use the quote-unquote hospice name, but we can do comfort care, keep her comfortable.
For 5 years now, right?
Now it's 7 years. For 7 years, she comes to my office every month, get her big 12 shot. And the son, he said the best part of coming to you is not getting the blood pressure checked, because when they come to the house, they do that. But I just love coming here because every time you kiss my mom, she perk her eye open. And sometimes I go between her eyes and kiss her and just kiss her all over her face. And she open her eyes and sometimes she perk her lips. Like, give me the kiss, give me the kiss.
Isn't that amazing?
So, the power of affection, true, honest affection, can work miracles in people.
And you find that, I find, when someone's sick, people are afraid to touch them.
Of course,
I mean, it's like, instead of hugging them more and touching their hand.
Go and lay down in bed next to them.
When you go to the nursing homes, you'll notice the first thing someone does is they put their hands out to you in their wheelchairs. They want someone to touch them. They're starving for touch.
Yeah. Oh, I used to go to a nursing home sometimes when I used to spend 12 hours just working. But I would go and hug my patient. And I remember coming home, my wife would say, like, take off your clothes right there by the door. Take your clothes right by, and I would go, okay. Go and take off my clothes, go on my underwear, take a shower. I didn't care. Forget about MRSA or this and that. Man, if MRSA is here, let me live with MRSA.
She just wanted to have you naked at home. Forget
yeah,
it.
probably.
It had nothing to do with that. But no, I hear.
I mean, you are so right. You see these people, they just want, like, just hold my hand. Hold my hand. And if you give them a hug, it's like, wow.
That's right. Crawl into bed with your loved one. Whether it's your mother, your father, somebody, you can just snuggle up with them.
And then you look at the bed that we get for the dying person. It's not a big bed that all the family can go in bed together. Get a big bed, man. Get a huge bed and let all of us jump in bed. Invite me over. I'll be part of the.
Right.
Bring my pajama.
Right.
Right.
Like, put your dog in the bed.
Yeah, just like everybody get in bed together and let the spirit, have a party.
Let your spirit have a party. Oh, I love that. That should be your quote.
The body cannot do it, but the spirit still can do it, and it will continue to do it after you die.
The dynamics of dying, that's true. There's so much about this, and I wonder, do your patients talk to you about this and say, I'm afraid, or what should I do, or what's it going to be like, or are they afraid?
Indirectly they do, but I know because, I sold my house, and I used to have a house in the Hampton. I gave it away to a charity company, blah, 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 just. So people will start doing things to downsize. And basically, the more you downsize to one little bed, one little hospital bed that fit only one small person, then that, they're throwing the tower.
This is a wonderful subject. This is so perfect for me, especially because when Bill needs new hearing aids, we go and we buy the best hearing aids for him.
Yeah.
When he needs something, he'll say, you really want to spend the money? I said, absolutely. Get your tuxedo out and get it clean because we're going to be going. And so I am very much of a futurist with this.
Of course.
And he is too, but I could see where someone who didn't feel the way I did could really take someone down. Why are you going to write this book, Bill? What's going to happen with that? Right?
So he put it together.
Oh, right. And it's got to be very encouraging. He goes on the email every day to see if one of the billionaires wrote him when they received the book. It's fantastic, isn't it?
Beautiful. It's and that's beautiful. I always have projects. I have Claudia that works with me, and she's my business development. And I tell her, like, I'm ready to open the next office. Not yet, Dr. Mencia. You have to get this stable. We have to get this organized. We need more money. I say, I'm ready to open that office because I see people coming, from a lot of people coming from Miami-Dade to the office, and I feel bad. I say, I don't have transportation. I had a big guy that was going to donate a huge amount of transportation to us, but then the family got in the middle. No. That's our money.
All the reasons they don't do it.
So, I say, okay, so my best thing to do is let me go and probably open an office in Hallandale. But, my objective is to open a center that is like my center. Well, all the consultants can work there. They can have all the services that we're having there. So,
well, your idea is right. Your idea is right, and we, of course, need to multiply you.
well, and that's easy because how do we multiply, doctor? Through education. So part of the program that I have is basically when doctors come in, they go through the headquarters, they get educated on what is the concept and how we work and how we treat our patient. And it's not only the disease, but the biopsychosocial component of the disease. Bio is what we learn in medical school. Psychological is, we hardly touch on it in medical school, but there is a psychological component to every disease. And social, that we don't learn in school, is how does that disease affect your social life? And if us as physicians, as providers, nurse practitioners, nurses, whatever we are, we think of those three components every time we hear of somebody coming in with a headache, or somebody coming for a quote-unquote, I just want to get a yearly checkup. I had a young guy that came like that. I just want to get a yearly checkup. I said, okay, anything going on? No disease, never been hospitalized, not even as a kid, healthy
as a horse.
As a horse. And we going. So I asked the nurse. The nurse stepped out and said, what concerns you? He said, well, I have unprotected sex, and I'm afraid. I'm really, really afraid.
So he should be.
I said, okay, who you have unprotected? With a prostitute. I said, okay. Don't worry about it. What we're going to do the whole World Cup, and you are going to buy some condom so that if everything comes back right, at least you know how to start protecting yourself. So you need to be a little bit stronger moving forward. So I became more of a father than a doctor. So here I am giving advice to this young man, because we cannot say, okay, let's go your parent to educate you now. Here I am giving parental advice to this young man. And we did all the tests and everything came back negative. And he said, oh, I'm so relieved. I said, don't be relieved. If you have HIV, it won't show up until 6 months from now. So he went back, what? He just looked at me. I said, we have to retest you in 6 months. And then after that, then we do it back in another 6 months. So a year from now, then you can breathe the way you just did now. So from now on, you're going to wear your condom, and you're going to protect yourself.
And at our expo, I don't know if I told you.
So sometimes people go to a doctor, and if you are afraid to talk, don't even come to me. You have to talk.
You're going to make people
because
talk.
How can I help you?
Right. Because most doctors don't want to take the time to talk, and you do. I think as you expand, what we have to do then is once a month, you have to have a seminar or a peer where all the patients from the different places can come and see you.
Right.
Because even if you have other people doing this, they want to attach themselves to you.
Let the spirit connect.
I understand that, but you have to be there. You have to be there, and I let you run over because you know that I've been watching the town. You're going to have to race to your office. I didn't tell you.
I didn't know
because I don't have anyone from this time.
I'm so connected here that we can stay until 8 o'clock.
I know that, but if you have patience, you can't.
I do.
I
do
as
have patience.
you have to leave. I've been saying I'm not going to tell him, and then he gets
since we have the time, let me just give one piece of advice. What's the name of that lawyer that come here sometimes?
Joe Karp.
Joe Karp. I love his show.
Yeah, he's a good man.
I don't want you to be a hippie with your dying process. Okay, it's not like don't worry about it, don't do anything. I believe in what he says. Put your affairs in order, regardless of your age. It's regardless of your age. You just have to have those things in order. But then moving forward, don't throw the towel. That's all I have to say.
No, that's true. That's good. That's a good way to do it. And go buy yourself a new car.
A new car, a big house with a pool.
Right. And get yourself a boyfriend
and
or
a barbecue.
Girlfriend, right?
Yeah. Or a friend, invite a friend over,
Oh, buy a friend, right?
No, invite.
I know.
No, I love friendship. Sometimes boyfriend and girlfriend is a commitment of paranoia. But I love friendship because friendship is, we say in Asian philosophy, the difference between brotherhood and friendship is only the blood.
I love that.
That is true
only
friendship.
The blood.
That is true friendship. So I love true friendship. A person you can go with anything, and it's like talking to a brother or sister of yours.
And sometimes brothers and sisters don't work out as well as friends. Sometimes good friends are better.
Right.
So if the spirit moves you, then that's what you have to do.
If the spirit move you, how's that song go? Let them tend to go.
He's gonna play. He'll play the music. But this.
Who is that? Richard Marvin Gaye? Or if the spirit move you.
No. Yeah. But the dynamic of dying is just repeating what you've said is. You're going to live to the very last moment. Let the last moment be great, and you don't know when the last moment is.
You don't know.
That's true.
So enjoy every breath you take. Enjoy every sight you see. Just enjoy every touch you get.
But
appreciate it and enjoy it.
But go to the doctor and get your checkups. Make sure you put your affairs in order.
Right.
And then just enjoy your life, right?
And don't throw that towel. There's too many towels on the floor already.
I love that. You got a lot of quotes to be able to put up this morning. Well, you have been so wonderful. And I loved this morning. I was saying, I'm going to just make him late for his patient. You have to drive faster to get back.
I go slow.
No, go slow.
I go slow. I have to get there.
Okay, so remember, you can go there this morning at 954-489-1345.
Dental is open.
Dental is open. Make sure you do have a good
Dr.
dental
Fari
work.
is there. Now, dental, we start as of today.
Yes.
We're going to be open every Saturday, just like medical. At the Fort Lauderdale every Saturday.
Have dental every Saturday also.
So Dr. Fari, who is a great implantologist.
How do you spell his last name?
F-A-D-I, Fari.
He was on my show.
He was on your
show.
He was
on your show when we did this. Dr. Fari.
Yeah, he's a great guy. He's a great implantologist, and he cares so much
people.
about. Yes,
people.
That's how spirits work. The spirit is what attracts good people. They just, if the spirit connect, is regardless what the body look like.
And don't be discouraged. Sometimes the spirit connects and it's the wrong spirit because you've had that relationship I've had. So go with it, and then if it's wrong, move on.
Exactly.
Right?
It will never touch. You just detach and move on.
Yeah, that's right. That's what you. It's amazing how you and I are. It is just a very thrilling thing for me to have had this relationship with you.
You can drop a water of oil in a glass of water, and still it's going to be a drop of water, a drop of oil. So if there is no connection, don't worry about it. Let it be.
That's true.
Don't let it bother you.
That's right.
Move on.
That's right. Let your energy move on and go see Dr. Mencia. You'll never be the same.
Hey.
Thank you, Dr.
Anita.
Mencia.
You're welcome.
Have a great day.
Thank you,
and
Richard.
We're going to just do a little commercial, and then I'm going to come back and talk about some of our wonderful, wonderful advertisers and whatever else I do. I don't know.
And the wonderful world of wellness.
Yeah, wonderful world of wellness. Yes, that's a very wonderful world. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.